Alrighty, hi everyone. Welcome to our August office hours. We're going to go ahead and give everyone just another minute or so to get settled. In the meantime, let me go ahead and kind of tell you about who we are at Paloma Health. So, in case you're new here, my name is Alex Ruiz. I'm the Director of Content and Community here at Paloma Health, and we are a full online medical practice that specializes in treatment for hypothyroidism and also Hashimoto's. And as I mentioned, we are a full online medical practice. So that means that, yes, we have blood testing kits available, which you can do from the comfort of your own home, but we also have thyroid experts that are able to fully treat you virtually. So, whether that's from the comfort of your own home, from work, from your grandparents' house, your parents' house, wherever the case may be, as long as you have a good connection, we can see you. And that also means full range. So we can order, additional labs if needed. We can prescribe medication refills, anything like that. What's really awesome about our providers and something that we truly pride ourselves on is that our providers really look at kind of a holistic approach to care, which means that they look at your whole entire body. So they take a lot of things like nutrition, lifestyle into consideration when developing your treatment plans, which we think is super important because, as you know, medication only does so much, and it's really up to a lot of lifestyle interventions in order to make those really impactful changes. So, without further ado, welcome to Office Hours. This is our monthly segment where we connect with experts like Mary Shomon here and some of our providers to give you just live questions, answers, and just insights into your own thyroid story. So without further ado, I'm going to go ahead and let Mary take it over. She's going to introduce herself, and then we'll go ahead and get started with today's questions. So Mary, take it away.
Thank you, Alex. And just want to make a point that Paloma is really a great option for people who want a medical practice that's solely focused on taking care of your thyroid. So many of us, myself included, know what it's like when you're working with doctors that are just not all that focused on your thyroid, or not that up to speed on the latest treatments, or not that open to the full range of various medication options. And with Paloma, you're definitely going to get that approach to your care, and you deserve it. You deserve to feel well, and you deserve optimal care. So I'm Mary Shomon, and I'm a consultant to Paloma. I'm a patient advocate for 25 years, and I've written 15 books on various aspects of health, including a number of books about thyroid issues. And so I'm excited to be here. So I'm not a practitioner, I am an educator. And so I will be answering your questions from the perspective of patient advocacy and education, and helping guide you to resources and information and questions you can ask your practitioners. So, okay, Alex, do we have the first question so we can go ahead and get started?
Yep, it's in the chat.
Okay, all right. I'm being a little bit incompetent today, so I got to look at the chat. Okay, got it. All right, so the first question today is, my T4 has been elevated for 18 months, and my endo cannot seem to get it to come down to under the normal range, taking Levoxyl and changing my doses every few months. Why isn't this coming down, and what meds and protocols are better? I've had heart palpitations very frequently since that time, and I would like to have that over with. This is an interesting question, because the issue is this person over medicated? Because T4 is the hormone that is synthetically found in Levoxyl or Synthroid, Levothyroid, Tyrosine. All of those T4 synthetic drugs are going to raise your T4 levels. The assumption is that T4 is going to convert into T3, the active hormone. So usually if your T4 is elevated because you're taking too much medication, taking the medication dose down slightly and rechecking, it's going to come back to a regular level. But in this case, if the level isn't coming down and this person has heart palpitations, which can be a sign of over medication, the question here would be, is there something else going on? Because there is a subset of people that have Hashimoto's who also have Graves' disease, or there are also periods of Hashimoto's where you can have overactive thyroid, where you're producing too much thyroid hormone. So I don't know that we can answer this question specifically, because if a dosage drop is not bringing down that T4, then I'm feeling like there needs to be further exploration, probably with an endocrinologist, to take a look at whether or not there are either toxic nodules that are producing thyroid hormone, or underlying Graves' disease that's making it periodically overactive, or if this person has a thyroiditis that is causing periods of hyperthyroidism, even though their underlying condition is hypothyroidism. Okay, let's see. Going on to the next question. I have Hashimoto's and I'm taking 25 micrograms of levothyroxine, and it helps, but it does not bring my TSH levels down to normal. I don't tolerate more than 25 micrograms and have tried it before. What are some other options for me to bring them closer to a normal level? So this is interesting because this is almost the opposite problem. This person is, their TSH is super high, indicating that they're hypothyroid. They're taking their medication, but it's not bringing that level down. So it's not optimally treating their hypothyroidism. But when they take more than 25 micrograms, they start feeling hyperthyroid and having problems with tolerating a higher dose. So the question here is, why are you having such trouble tolerating a higher dose? There are a couple of reasons for that. It may be that this medication, the levothyroxine, is not the best choice. It could be a switch to a different brand would be better, or a different form of levothyroxine. I've worked with, in my coaching practice, I've worked with patients who were taking tablet form of levothyroxine who switched over to a liquid form like Tirosint or Tirosint Sol, and they were able to finally absorb their medication. Because there may be malabsorption or some sort of gastrointestinal issue. So sometimes it's worth changing the form from tablet to liquid. Or in some cases, there are people who just did not tolerate levothyroxine. It did not help bring down any doses. That higher doses did not help bring down their levels. And they ended up switching to natural desiccated thyroid, like Armour or NP thyroid. And that was they were able to take that and tolerate it. Another question is, are the adrenals strong enough? Because if there's adrenal fatigue or adrenal insufficiency, in some people, adding even a small additional dose of thyroid medicine will create intolerance issues, and they need to focus in on getting the adrenals shored up and strong before they can up their dose to a level that they need for adequate thyroid replacement. So this one, again, requires a little bit more investigation into what's going on. But working with a good doctor, this patient should be able to either switch up some meds and see if that works and they can tolerate a higher dose, or explore whether or not there may be something else going on behind the scenes. Okay, let's see. We got another question here. How important is it to get optimal levels of free T3 and reverse T3? This is a good question. And really, the answer depends on who you ask. Some doctors basically believe that only the TSH is important, and that we want to get the TSH into the reference range, into maybe the midpoint or the lower half of the reference range, and that's what optimal is considered. Other doctors will look at free T4 and free T3 levels, with a focus more on the free T4, with the assumption that you're going to convert your T4 into T3, T3 being the active hormone at the cellular level. And so that will focus on making sure you have enough T4 in your system. But some doctors also believe that monitoring the free T3 levels, the level of available T3, the active thyroid hormone, is important as well. And that optimal levels of free T3 would be at the midpoint of the reference range or somewhat higher. Reverse T3 is even more controversial because a lot of doctors think it's not relevant to thyroid treatment and thyroid care. But again, some doctors that look at things more holistically, including some of our Paloma experts, do look at reverse T3 and feel that it is a relevant metric and marker for us to look at to make sure that someone's getting optimal treatment. So reverse T3 levels tend to, we want to tend to see them on the lower end, below 12, below 11 or so. Higher levels indicate that we're producing a lot more reverse T3, which is the inactive and useless form of T3. Gets counted when we're totaling free T3, but the reverse T3 pulls out that inactive amount and gives us an idea of how much of that blocking and essentially fake T3 we have floating around in our system. The higher the stress in the body, the higher the reverse T3 tends to be, and the less of our T4 is converting into actual T3. So it can be very important for some patients, but for other patients, if their free T3 is adequate and someplace in the reference range, they're going to feel fine. Some people go through their entire life as a thyroid patient and never check their reverse T3, and they get good treatment and they feel well. Other people who have difficulties, again, I think it's more if you don't feel well, the more you can dive in and look at these other markers, the more likely you are going to be able to pinpoint what's really going on and what we can do to help reverse it. But high reverse T3 typically involves reducing stress then, and on the body, emotional stress, physical stress, nutritional stress, getting enough sleep, helping make sure the adrenal function is strong, and getting rid of any underlying infections and other stressors in the body that can increase that reverse T3 level. Because once we get reverse T3 down around 11, then usually it's not going to be interfering with our thyroid care. Okay, we have another question. Got my lab and scan results back. This person has thyroglobulin antibodies of 14, thyroid peroxidase antibodies of 734, TSH of 1.56, a T4 of 1.2, and a T3 of 3.3. They had an ultrasound with diffusely heterogeneous thyroid gland without discrete nodules. Doctor said it's Hashimoto's, but since my labs are normal, my doctor's saying there's not much to do since my thyroid is still functioning normally, and to do the wait and see approach. I've been dealing with fatigue, brain fog, memory, concentration, etc. Do I really just sit around and wait for things to be worse before anything can be done? Well, this is again another controversial question, because in thyroid care, a lot of things can be on the line, and there's questions one way or another which way to go. There is some research that shows that people who have elevated thyroid antibodies, and in this case, the thyroid peroxidase antibodies of 734, are quite high. Normal is usually under about 35. So this is very elevated antibodies, and it's indicative of a thyroid that is under autoimmune attack, which means that it typically is going to have some inflammation. As we could see from the ultrasound, it's slightly enlarged. It doesn't have nodules yet, but it's a little bit enlarged. So it's already under autoimmune attack. But in this case, this patient does have normal thyroid levels. The TSH is 1.5, T4 and T3 are both normal. So most doctors are not usually going to want to treat with thyroid medication. However, there is some research out there, and there are some doctors that do practice, and it's considered outside the normal guidelines, but those doctors will go ahead and provide some degree of thyroid treatment as a preventative, because treating high elevated antibodies in some patients can actually reduce the antibody levels and prevent the progression to full hypothyroidism, to overt hypothyroidism. But again, it's kind of a hit or miss whether doctors will do that or not. Some of the other things that doctors can do that some of the Paloma doctors have worked with is low dose naltrexone, because this is a prescription medication that at very low doses can help reduce antibodies and calm the inflammation, and may reduce those antibodies, reduce some of those symptoms, because this patient is having a variety of symptoms, fatigue, brain fog, memory, concentration, etc. So if we're talking about those kinds of symptoms, we may be able to reduce some of them, because they may be related to the inflammation and the Hashimoto's, with a drug like low dose naltrexone, which is considered very safe and minimal side effects. The other thing that we can look at is also anti-inflammatory diet, or the autoimmune protocol. And we have lots of information at our website about that. And our app helps you actually guide you through following the autoimmune protocol diet, also referred to as the AIP diet. We can also make sure that we're getting the nutrients that are needed to support the thyroid and reduce the inflammation. So our thyroid care supplement has some of these nutrients, but we want to look at making sure we have enough tyrosine and zinc. And some cases, people may need a little bit of iodine. Selenium is especially important for lowering antibodies. So these are some additional things that we can do to help calm the inflammation and the autoimmunity. Okay, Alex has another question. I just got diagnosed and missed my medication a couple times this week. Is that bad? Should I double up the next day? This is a pretty common situation. And the question really, the answer really is depends on what type of medication you're taking. As far as I'm aware, the guidelines for levothyroxine drugs, so synthetic T4, so that would be the drugs like Synthroid and Levoxyl and Tirosint, Euthyrox. If you're taking a T4 only synthetic drug and you miss a dose, the instructions are to go ahead and make up the missed dose as soon as you realize it. However, if you're taking a medication that includes T3, so if that would be if you're taking Cytomel or liothyronine in addition to a T4 synthetic, or if you're taking natural desiccated thyroid drugs, they do not recommend that you double up and take an extra pill or your extra dose when you realize you've missed it the day before, because the T3, it can be too stimulating for some people. So the real issue here that's important is if you just got diagnosed and you're being treated, don't miss your medication, because the really crucial aspect of thyroid treatment is consistency and taking it every day. And the sooner that you get on a regular schedule of taking your medicine daily, the sooner you're going to feel better. And the sooner you're going to get your thyroid levels back to those optimal levels and start really calming down this hypothyroid situation. So if you want to have more energy, feel better, start having your metabolism work better, and get rid of all of those sluggish hypothyroid symptoms, make sure you take your meds. If you need reminders, there's lots of apps that can remind you to take pills. You can set a schedule in your calendar and with a reminder to come up every day at a certain time. Some people have little tricks. They put it next to their coffee pot or next to their toothbrush, or they put it upside down when they haven't taken it and turn the bottle back upright. Whatever it takes for you to remember to take your meds, try to make sure that you take them on a regular daily basis, because that's going to be the best possible solution for you. Okay, let's see here. We've got a long one. I'm going to read this one. I'm a woman, 58, who eats an anti-inflammatory diet and does about 13 hours of exercise a week. Wow, she's doing more than me. After a recent reduction in my prescription, I'm now on 50 micrograms of Synthroid T4, 7.5 micrograms sustained release T3, and my T3 and T4 results are now in the lower quadrant of normal. The slight decrease in my prescription helped bring my TSH to the bottom of the normal range. This was after a reduction of T3 from 8 to 7.5. Consequently, I've gained 8 pounds as a result of being on a slightly lower T3. I want to switch back, but below normal range TSH indicates my thyroid is not having to produce T4. Should I switch back from 7.5 to 8 and find a way to prevent bone density loss via supplements? Are there other risks of having middle T3, T4 with below normal TSH other than bone density? Okay, well, this is again another controversial question, because there are some doctors who really focus primarily on the T4, T3 levels, because those are the circulating thyroid hormone levels. Others feel like TSH has to be in range, or there is risk to your system. This is one you're going to find really different attitudes from different doctors. Some doctors are going to say, look, I'm not going to pay attention to the TSH, and as long as your heart rate's normal and periodic bone density tests show that your bone density is not at risk and your heart is fine, we're going to go ahead and treat you, keeping that T4 and T3 within range, but with the latitude to take it up out of the low end of the reference range. That usually is going to help resolve symptoms. To have a low or mid-range T3 indicates that you're on the low or middle range of the active thyroid hormone. And as this patient saw, just a slight reduction in that T3 can affect your metabolism to the extent that she gained 8 pounds fairly quickly. So the question here is probably talking to the doctor and figuring out what the safest amount of medication is going to be that can safely and best relieve the symptoms. And the decision about what that range of medication is going to be is likely going to depend on the doctor that you're working with. No doctors are going to over medicate you to the extent that your T4 and T3 are high out of range in hyperthyroid level and your TSH is so suppressed it's 0 or very close to 0. But there are doctors who will work with you to make sure your T4 and T3, the actual thyroid hormones, are in the optimal level. Okay, next question. Can Hashimoto's influence blood sugar levels? Yes, absolutely. Hashimoto's can influence your blood sugar levels because it's an inflammatory condition. And inflammation increases stress in the body, which causes the body to release more cortisol and in some cases even adrenaline or epinephrine. And these stress hormones definitely increase your blood sugar levels, as well as general inflammation can increase your blood sugar levels. There are actually some studies that show that if we lower blood sugar consistently, that it can, in some cases, help lower antibodies and can give us better resolution of our hypothyroid symptoms, and even in some cases, affect our TSH and lower it. There's even some evidence that taking medications like Ozempic, which is a type 2 diabetes medication that's used to lower blood sugar and also help lower blood sugar as an adjunct to weight loss, can also help improve hypothyroid symptoms and Hashimoto's. So definitely a relationship there. And working the other direction, if you have Hashimoto's, you should be making sure that on a regular basis, when you get your annual checkup at minimum, that you're having a fasting blood sugar and a hemoglobin A1C or HA1C test. That HA1C test is going to measure your average blood sugar over about a 3-month period. So this is going to give us a better sense of throughout the day, throughout the night, over a 2 to 3 month period, what is that blood sugar doing? Is it under control? Is it staying at healthy levels, which tend to be under 100 at fasting level and under 140 after you've eaten? Okay, next question. I was diagnosed with hypothyroidism in 1980 and have been on myriad medications since then. Very common story. Most recently, I'm on compounded medication, which has helped with my sluggish digestion and low body temperature. My labs, however, indicate both low TSH and T4 levels. I've read that this could be secondary hypothyroidism caused by a pituitary condition, but other than water metabolism imbalance, I do not have other symptoms of pituitary disorder. Do you have any recommendations to delve in further? Well, this is one of those questions where my first question to this patient would be, are you feeling well? Because if you're feeling well, and you're not having any other evidence of under or over medication, so you're not exhausted and hypothyroid symptoms, and she said that her sluggish digestion and low body temperature improved, but if the TSH is super low, are we looking at any evidence of over medication or hyperthyroidism? Is there a high pulse rate, diarrhea, high blood pressure, any other signs? So, because if your levels are somewhere in the reference range and you feel well, hooray, you have found the magic place in hypothyroidism, because that's what we want. We want to feel well. If I feel great and my TSH is 0.5 above or 0.5 below, it doesn't matter as long as I'm feeling well and I'm in a healthy place in the reference range. The question really is, when people don't feel well and they're in the reference range, what do they do next? So I would not, in this case, I would not worry that much about why these labs are a little bit different but as long as they're within the range and the patient is feeling great, that's nirvana. That's the sweet spot. So if there is some sort of secondary hypothyroidism or pituitary conditions, etc., that would be something they would have to explore with a good endocrinologist to evaluate. Okay, one question here we have, my TSH is 4.25, but 2 weeks ago it was 10. My T4 is 1.04, my thyroid globulin is 85, and my TPO is 785. I have an ultrasound scheduled. I'm hoping anybody has had hormone or antibody readings like this, and it's Hashimoto's and not cancer. My doctor hasn't been very reassuring, which I get isn't her job, but I'm trying not to panic over here. Okay, first of all, don't panic. I'm not a doctor, so I can't make a diagnosis, but I can tell you that a TPO level of 785 with a TSH of 4.25 could be very consistent with Hashimoto's. Okay. And even when the TSH is bouncing around, it went from 10 to 4.25. This can be the inflammatory process in a thyroid going on during the onset of Hashimoto's, because a very elevated TPO like that is very likely to be indicative of a autoimmune thyroid condition, Hashimoto's. So you're having your ultrasound. They're going to take a look at it. They may find some nodules, which would be very normal with somebody who has Hashimoto's and hypothyroidism. And if they think that any of the nodules look suspicious, which is not that likely, only a small percentage of nodules don't look like normal garden variety nodules, then they can do a biopsy of the nodules to determine. But 95% of thyroid nodules are not cancerous. And thyroid cancer is not very common. It's on the rise, but it's still a very small percentage of people with thyroid conditions. So my advice would be to take a deep breath, calm down. Your doctor might not be willing to reassure you because that's not her job, but we will reassure you that they're going to be able to get to the bottom of this very quickly and figure it out. And it's very likely that it's probably Hashimoto's and with some hypothyroidism associated, which is the majority of thyroid conditions in the US. And certainly most of the patients at Paloma fall into this same category as well. All right. And I think our last question is, can you have high TPO antibodies, that's thyroid peroxidase antibodies, and not have Hashimoto's? This is a good question. I'd probably need to go back and look at the medical books and do a little bit more research, but I am not aware of a situation where it would not be Hashimoto's, but there's probably some reason why somebody could have extremely elevated antibodies and not have Hashimoto's, but for the most part, you can. And so I would guess there might be somebody. So I'm gonna sort of whiff on this one because I don't really know the formal answer and I don't want to give a definitive answer. But I will flip the question around because we get this one all the time too. Can I have Hashimoto's but not have antibodies? And that I can say absolutely yes, because I think it's like 10 to 20% of people with Hashimoto's will at some point not test positive for those antibodies. They're going to have normal antibodies not being elevated. But yet when some of those patients have had biopsies or in some cases thyroid surgery, when they do a pathology assessment on the thyroid or the biopsy results, they find out that there are Hashimoto's, evidence of Hashimoto's in the gland, even though the person never had elevated antibodies. So it works the other way for sure. And does it work the opposite way? I don't have a definitive answer, but I'm going to assume there's probably some situation where somebody could have extremely high antibodies, but it's not necessarily Hashimoto's disease. So I'm not sure if we have any other questions. Alex, are we all set? Do we have everybody covered?
No, that's pretty much it for today.
Great.
Thank you so much, Mary, for all of that. So guys, thank you so much for participating in our August office hours. Those were all really great questions. We love bringing this kind of opportunity where you can really just give those personalized scenarios of your care and kind of just getting insights. I know as a thyroid patient myself, especially when I was first diagnosed, it can be really scary and overwhelming. And, yeah, maybe that's your situation, but this is my specific situation with my labs. And there's just this sense of peace when somebody listens to what you have to say and kind of gives that insight. So thank you so much for sharing. Again, if you are not familiar with Paloma Health, go check out our website. We do have our membership, which if you become a member, you get discounts on our test kits, you get discounts on our supplements, and you have the ability to book appointments with our providers and thyroid experts. And you can receive care from them virtually from the comfort of your own home. As Mary mentioned early on, we also have a free app that you can download here, available only in the United States. And it has a plethora of resources from meditation, yoga. It has recipes, guides and resources, blogs, you name it, it's there, symptom tracking and everything. You could upload your labs and kind of keep a record of everything all in one place. So go check it out. It's a free download. And again, thank you so much for joining us, and we'll see you